GATT has been performed throughout the world in two ways mostly. One is with a suture, which is a kind of homemade suture by cauterizing the tip of a proline suture or a nylon suture, or with the catheter. This sharp point suture is ready-made to be used for GATT procedure and is purposely shaped for being introduced inside the Schlemm canal with a relatively ease and allowing a good performance and easy learning curve. The technique itself is the same. With the suture, sharp point suture, the suture is introduced inside the Schlemm canal and advanced using forceps. And of course, is a fundamental at the initial part of the procedure to be sure that you are in the right position anatomically. And then the suture can be pushed along the Schlemm canal until it reaches again a 360-degree path. With the catheter illuminated, you can follow the track of the tip of the catheter flowing along the Schlemm canal for its 360-degree path. And so in a way, you can be kind of reassured that what you actually aiming to do is actually taking place. With both techniques, the result is pretty much the same. At the end, what you want to achieve is a complete opening of the trabecular meshwork and Schlemm canal, whichever way you perform it. Of course, in terms of convenience, the catheter is far more expensive than any type of suture possible, and therefore there is an advantage at the end, economical advantage particularly, that I see that could actually allows more people to be interested with this type of procedure. At the end of the procedure, if the suture is pushed throughout along the Schlemm canal for 360 degrees, then is pulled and with consequent opening of the Schlemm canal and trabecular meshwork, and it normally is visible a certain amount of bleeding coming from the angle for 360 degrees, and that is the indirect sign that the trabecular meshwork and Schlemm canal were open. GATT requires, as with any angle procedure, requires the use of a gonio lens. And to be accustomed to a gonio lens, it takes some time, okay? But again, once you have mastered the use of a gonio lens and being able to work with both hands at the same time, then GATT procedure is relatively easy to acquire, because you have to recognize basically the anatomy and then create an otomy and introduce the suture or the catheter inside the Schlemm canal. Once you master these two things, then all the rest is very simple and easy to do. Whereas, of course, with trabeculectomy and then also with an implant of a valve, there are many more variables that need to be acquired and mastered before you can accomplish a repeatable procedure. So in a way, I believe that it may seem to be more difficult, but at the end is probably much easier than a trabeculectomy.